In this three-part series, I'll be doing 3 different ways that you can get into nursing. The first, part 1, which will look at how you get into the traditional route of nursing. The second part will look at how you can earn whilst you learn to become a nurse. And the third part of it will also link into that. So if that's something that you're interested, please come along. Hi, my name is Sabrina Phillips. I'm currently an interim director working with the NHS as well as other partners. And on this channel, I give you the tips and tricks to skyrocket your nurse career. I will do some simple lock hairstyles at some point, and once we can travel, I'll give you some budget tips so that the money that you make can go that bit further. But anyway, let's get into this video. So as I said, in this video, I will be telling you how to get into nursing via the traditional route, and that's usually applying to a university and doing a 3-year degree. You're thinking, okay, so who can apply? This video pertains to the UK specifically. So to apply for nurse training in the UK, you should have either settled leave to remain or be a UK national. 18 years or over. My understanding is there is no upper limit in terms of what age you can't apply to be a nurse. There are 4 branches. So there is an adult nursing, there's child nursing, there's mental health nursing, and there's learning disability nursing. So those are the 4 choices that you would have when you decide that you're going to apply to do a degree in nursing. And there's also some universities that offer joint training with a dual qualification. So if that's something that you're interested in, do have a look at the different universities, and I'll give you some information on where you can find that out. What qualifications do you need to apply to do a nursing degree? So in the UK, you need at least 3 A-levels as well as GCSE subjects, and for some universities they might request that you have a health or science-based subject as part of your A-levels or your GCSEs, but I would suggest that you, whichever university you decide to apply for, you check what their criteria is, and if it isn't clear, I would suggest contacting them directly so that they clarify what you need. For some people, they might already have a current or previous degree, so you could potentially use some of that degree that you had to apply as well. And what that means is you might also be eligible for doing the fast track or 2 years postgraduate nurse degree training. So again, if you've got a previous degree and would potentially like to do the postgraduate degree in nursing, what I would suggest you do is ask the university that you are applying for, because they'll be able to give you the pros and cons of either doing the 2-year or the 3-year course. And I guess it goes without saying, a 2-year course is more intensive. A 3-year, it takes a bit longer time, but you'll be learning the same things on both courses. It just means the intensity is slightly different. And with all nurse training, you do a bit of practical work. So that's where you actually go out into clinical environments, practice the skills that you've learned in university or your academic work, and you're marked on a 50% of both. So just to be aware, that's how nursing training is. Where do you apply to? So as I've said, most nurse training is delivered by universities, and in the UK you would have to apply via UCAS if you want to do a full-time nursing course. There are some universities that would offer part-time nursing, but again, to do that you have to look at specific universities. And one tip I'd say is, university is a time to move somewhere else, learn about a different place, as well as make new friends. But what I'd say to you is, in terms of nursing, is thinking about, if you are going to train to be a nurse, do you want to work close to where you currently live? So it might be better to look at universities that are near to your where you live. There's not an issue in terms of going further afield, but it's just thinking about when you're applying for a job at the end of your nurse training, you might have an incentive if you are working in your area or location where you work, where your hospital actually offers you a job without having to interview. So your third and final placement is sort of your interview into that job. So it's just something to be aware of, is thinking about where you're going to go to university, but also where you'd want to work as a nurse once you're qualified. Funding behind this. So if you're applying for a 3-year nurse degree, you will have to also apply for student loan, and it is upwards of £60,000 or more, and that's just for the course. That does not include your day-to-day living expenses. Currently there is a fund that nurses can apply to that you get up to £5,000 to support with your day-to-day living, and you do not have to pay that back. So that's one of the things you will have to think about if you are going down the traditional route in terms of the student loan that you will take out, because once you qualified and you're earning a certain amount of money, you'd be expected to pay that back. So that's something to think about. And I guess, you know, for colleagues, people that are listening who may have, you know, other responsibilities, you might have to weigh up the cost of going to uni, not only taking out a loan, but also how you're going to support yourself during that time, as well as the responsibilities that you do have. And as I mentioned before, thinking about where you go to uni as well, because university, when I say uni, because you need to be thinking about your cost of living, so travel, rent and food. As a number of universities, they may have a number of virtual open days, so you get a flavour of what they're asking for. So different universities' training are different. So for example, some might have where a specific chunk of your time is in university and a specific chunk is spent in placement. There's others that mix it up, so you might have 2 weeks in university, 3 weeks in placement, followed by 2 weeks in university. And for some people that works really well, for others it might not, depending on your situation. So I'd say have a look around, speak to the universities, see how the training is set up, so that when you make the choice, it is right for you and the situation that you're in. But I hope you do take the path of applying for nursing. I will put some links in the description box to UCAS. Well, in part 2 of this video, I'm going to tell you about how you can still get into nursing but earn whilst you learn. So if that's something that you're interested in, please do join me on the other video. But until then, be bold and be brave, and I'll see you on the next one. Bye.